Hi everybody, Kevin Kane again talking a little bit about BadgerCare, what was supposed to happen in 2014. What was supposed to happen is states were going to receive large amounts of federal dollars to make sure that their Medicaid program, here in Wisconsin we refer to it as BadgerCare, would help make sure that those individuals who were low income that so much that being able to go to the exchange, this marketplace, would still be a little bit too expensive for them. They would have had access to our state's Medicaid program known as BadgerCare. Now this was going to become the rule across the country. All states would have a minimum level of coverage so that when you were $1 over what was allowed to be in our state's BadgerCare program, you'd be able to go to this new marketplace and be able to get a tax credit that was affordable for you to be able to purchase private health insurance. That's what was supposed to happen. When the Supreme Court was looking at the constitutionality of the Affordable Care Act, they upheld the law with one small exception, and that was they said that this new part on Medicaid, states now had the option whether or not to accept. States could now decide we do not want to accept these additional federal funds in Medicaid, and a number of states have chosen not to do that, and most notably that's Wisconsin. Now, I say chosen now because these federal funds can be taken at any time. They do not sunset. But the deal for Wisconsin actually goes down slightly over time, and so it's really in our best interest to take these federal funds. Now, Governor Walker announced back in February that we weren't going to take the federal funding, and the legislature decided in the state budget that we weren't going to either. Governor Walker's plan will kick 98,000 people off BadgerCare, on top of denying people who are on the waiting list now at the ability to go on the program. This decision is going to cost the state $149 million, this state budget alone. Because when people get sick and injured and they have no health insurance, we still find a way to cover them. Whether they go to emergency rooms or county mental health centers, we decided a long time ago as a society we were not going to let people die in the street. And so because of which, these costs get pushed on to many, many other people. We take care of individuals even when they don't have health insurance. So it makes a lot more sense for us to actually protect people and keep them healthy and prevent diseases by offering them BadgerCare. So in our case, by not covering these thousands and tens of thousands of individuals, we are actually going to be paying more money to cover less people in our state. Now there's some good news and some bad news about this whole thing. The good news is a number of these individuals who should have had access to BadgerCare will still be able to go to this private marketplace and purchase health insurance with a tax credit. The bad news is this population was never expected to have to buy insurance on their own. They were always expected to be able to be covered by BadgerCare. And so between deductibles and premiums, there is question about whether a number of these individuals will be able to afford it, even with increased transparency, accountability, and competition. The additional good news is that, again, Wisconsin can accept these federal funds at any time, and so we need to continuously talk about here in Wisconsin that we need to take these federal dollars. It can be done tomorrow, next budget, next year, whenever. So the thing is, this will happen. It's a question of how long we can hold out, because organizations across the state and across the political spectrum have called for taking these federal dollars. From the Hospital Association to the Medical Society to business organizations, labor organizations, faith groups, the list goes on. And before you assume that this is a partisan issue, we should note that of the other states that have accepted these federal dollars, 9 other conservative governors have accepted these federal funds and said that this is something that they must do for the state. States like New Jersey and Ohio and Florida and Arizona, their governors have called out saying we need to take these federal dollars. And so this is not a knee-jerk partisan thing. This is a common sense policy decision that we will continue to push for until everyone is guaranteed quality, affordable coverage. So this is something we'll continue to push for. I want to make sure that you all get a chance to like and comment below, and please share this video as we continue to talk about the Affordable Care Act and healthcare, and we get a chance to answer all of your questions. Thank you for watching.